good morning. My name's Amanda, and I'm the Community Outreach Coordinator here at the Missouri Poison Center. And with me today is Julie Weber. She is the Managing Director here at the Missouri Poison Center as well, and a pharmacist by background. And we're going to talk today about some of the history and our mission and heritage here at the Poison Center, kind of how we started, what some of our mission and goals are, and sort of a little history of our background. So I'm going to pass it off to Julie to start that today.
Great. Thank you, Amanda. Yes, our mission is really important to us, and it's our Mission and Heritage Week with SSM Health. And it's a special opportunity for me to look back at our journey with SSM and the history of the Missouri Poison Center. The vision and dedication and commitment we have to provide this service for the state has been inspiring. Our mission itself, it really is about protecting Missourians from poison incidents by providing emergency assistance, expertise, and preventative education, advocacy, and research. So I like to kind of bring this all together, and this really kind of fits into what we've been tasked by the state to do, is really to bring our expertise to callers to our hotline, education, which Amanda does a lot of out into all the communities, and really the advocacy of really helping when we know there is a problem out in the community, and then what we do to help prevent that and keep both children and adults safe. So as we move on to basically looking at my team, we have a great group together here, and our employees really strive each day to serve our callers in accordance with really the values of the Franciscan Sisters of Mary. We value the sacredness and dignity of each person, no matter how young or old. We find these 5 values really consistent with our priorities of showing compassion, respect for all of our callers, excellence, stewardship, and community. We help serve those who really are at need, as well as anyone who contacts us. I think the 5 words really describe how we always want to treat your family and you, and believe our caring and commitment really to the whole person and family sets us apart. So as we go through the history a bit here, it's really hard to believe, but the Poison Center, or Poison Control Center, began at Cardinal Glennon Children's Hospital really just 2 years after it opened its doors. So we have a very long history with Cardinal Glennon and serving everyone in Missouri. Our calls were then answered just by emergency department personnel, like the physicians or nurses, who would walk by and just pick up the phone and help. In 1969, there were 15 poison control centers that served the surrounding areas and counties. And this was, even at one time, there were hundreds of centers that operated, and then it gradually went down and down over the years. It's really exciting and that we're still here. At 1974, we began using full-time nurses and pharmacists to actually be hired and answer the hotline. The cases continued to grow, and we really saw a need of this. Some history as well is when we look at the 60s and 70s, is National Poison Prevention Week actually began in Missouri by a pharmacist, Homer George, who actually brought light to the issues of children being poisoned. So as our mission continued, in 1978, technology began to be inserted, and there was a toll-free telephone technology that we added to the Poison Center, making emergency access available statewide. And then what happened in 1986 really changed everything for the Poison Center. We began at that time to seek provisional and as a really certification as a regional poison center. And that was achieved. And from that provisional accreditation, we became fully accredited in 1986. And what happened then was an advisory committee was selected, and it selected the Cardinal Glennon Children's Hospital Regional Poison Center to serve the entire region, which is the state of Missouri. So what this provision was essentially to provide a 24-hour telephone hotline to all of Missouri residents, design and coordinate a professional and public education program to really bring out that poison prevention awareness and stop poisonings, and to develop plans to cooperate really with EMS, with the hospitals, and have a whole network throughout the state that would have access to our services. We also began evaluating the program and having a formal collection of data that also was shared with the Missouri Department of Health, as well as the American Association of Poison Control Centers. This coordination throughout the state relied upon the Poison Center at Cardinal Glennon Children's Hospital and developed over time. I think here too, just to take one step back, I wanted to point out that many Missourians recognize Mr. Yuck. Mr. Yuck was one of the early tools adopted by the Poison Center to teach poison prevention. All right, then what we go into, and this slide brings back some memories. So you talk about technology, and we had implemented the toll-free telephone number. And what you see here is actually, this is the year I started in the Poison Center. And what we have there is one computer that we shared this technology back and forth to look up different products. We also had, what you don't see there is 2 telephones with 12 lines ringing in and 2 people answering those calls. And basically the way you could triage those calls was asking someone to hold. And I remember anxiously waiting often to use that resource to look up the different products, such as what's in Clorox, what's in this cough or cold medication, what's in this insecticide. So we had shared that shared service, and really my start there was as a student and then continued on as a pharmacist on the hotline. All right, as we continue with our timeline here, basically what we're seeing is in 1989, as well as obviously my career starting there, but we had the Power Over Poison program. And this was a large program that was utilized in the state, began in small areas, and went around the state bringing awareness to poison prevention. Poisonings, you wonder, like, how did this land at Cardinal Glennon Children's Hospital? And I still think what we see is poisonings are a pediatric problem, and that's the majority of the cases, are over 42% in children. And this awareness with this program brought out poison prevention tips in the home, as well as brought a great recognition for the Poison Center and our services. So we also had, over the years, were a member network of hospitals. And so there was a membership that hospitals would pay to receive the services of the Poison Center. And back in the day, we really were always on the edge of technology. We had set up, when there was the first facsimile machines out, we put that in each emergency department across the state, and then educated them, and they were able to receive our treatment guidelines that were developed to help them beyond the phone consultation, to have something in hand to follow for the treatment of their patients. Now, as time progressed, our services grew as well as our case volume. I know at some points in time we went, from maybe 30,000 calls up to over 100,000 calls, doing full pill identification, as well as helping people with exposures and information. So with that too, our support also helped with the awareness. We needed help with the support. And this is a big step in 1995 with the help of the Missouri Hospital Association. They diversified our funding, and we were able to offer these services free to all the hospitals in the state, as well as we continued our free services to the public. And with that, our cases grew as well as our personnel. So another big step nationally was the recognition of poison centers, and finally to give some relief to the different budgets for the poison centers. There's only 53 in the whole US, and often there's a host institution like Cardinal Glennon for us. Other ones are with schools of pharmacy, others with universities. So to diversify this funding, we also ended up getting a nationwide toll-free number for all poison centers. And that technology at that time really directed the call to the poison center in that state or region that they managed. This was a huge development and awareness done with the American Association of Poison Control Centers, as well as HRSA, to help diversify and stabilize our funding. So from that, we worked closely with HRSA, as well as they wanted to integrate health departments with poison centers. And so in 2009, there was a need for the real-time disease detection grant. And what that did is it helped us cooperate more with the Department of Health. And with this partnership, began even a bigger partnership. In 2009, some of us remember the H1N1 flu outbreak. And with that, we began to surge up our lines with our staff and others, and we operated a temporary H1N1 flu hotline for the state. We were able, with our nurses and pharmacists, to answer questions and availability about where they could obtain that vaccine, as well as side effects or any other effects they wanted to report. So a little bit of a theme here that I mentioned is about our technology. And in 2015, the Missouri Poison Center dropped a little bit of the Cardinal Glennon name because we had to reach out to the entire state. And we also they are our host institution and recognized as a program of them. But the development of the Missouri Poison Center website and social media launched in 2015. And this brought opportunity through technology to bring our services to those everywhere in the state, as well as the technology for those to meet where they are. All right. In 2017, texting and chatting services were integrated. So as you can imagine, our phone system totally evolved from those 12 lines ringing in at one time to an automatic call distribution system that allowed us to more easily manage the cases and calls coming in. And then this texting and chatting service, again, was integrated into the system that allow our pharmacists and nurses to be able to more easily manage those calls and contacts and really meet our public where they are and how they want to speak with us. So it seems like it wasn't that long ago, but in 2020, once again, the state began to need our help and surge up with the COVID state public health emergency line. As I mentioned, this was really a cooperative agreement where the Poison Center is a backup for the state. We run the public health emergency line for the state when they become overwhelmed and to help support them. So 2020 brought a year of unprecedented items that we never thought we would see, as well as just to the poison hotline with bleaches, hand sanitizers, all types of cases that we wouldn't imagine we would see exposures like that. As we continued our technology journey in 2021, the Missouri Poison Center wanted to kind of calm that chaos and give a credible source of information to the public. So what we did is we developed a Missouri Poison Center app that's available in the Google store as well as for Androids. And from our website, you can download this app, and it brings to you a credible information from our specialist about is something a poison, first aid, and just a variety of tips to keep you all safe. Now in 2022 came another time of change. The American Association Poison Control Centers, actually, as you can tell, that's a mouthful, rebranded themselves as America's Poison Centers. And with that, we became a member of what is now America's Poison Centers. And today we continue to offer free, fast, confidential service. So what you see there are two logos. That's the original Poison Help logo that in 2022 changed into the Poison Help logo of today. All right. So with there, I really want to do our call to action, as I mentioned, to download the Missouri Poison Center app. There's a QR code on our website that makes this available and something to have at your access and fingertips. Amanda always does a great job at calling to action of saving the app and our phone number. And I'll turn it back to her.
Thank you very much, Julie, for that timeline history, sharing our mission and values here at the Missouri Poison Center. We certainly want to thank you for your dedication throughout the years here at the Poison Center. In general, the Missouri Poison Center has been around for many decades, over 60 plus years, and we hope to be around a lot more in the future for everyone here in Missouri. So please save the app in your cell phone so you have quick and easy access to reach out to our registered nurses and pharmacists here at the Missouri Poison Center, and have a wonderful rest of your day.
Thank you.